Well, many of you have probably heard about the new guidelines from the CDC saying that anyone who is fully vaccinated can resume most activities without wearing a mask or social distancing. Well, in response, many national retailers have actually dropped their mask mandates. You can see a few of those stores on your screen right now. You have BJ's Wholesale Club, Costco, Publix, Starbucks, Target, Walmart, and several others on there. So now many are asking, were masks for the fully vaccinated just public theater all along? Well, let's ask someone who called out Dr. Fauci about that very topic months ago. Kentucky Senator and medical doctor Rand Paul. Senator, welcome back to the show.
Thanks for having me.
Hey, Senator, Dr. Fauci was on Good Morning America yesterday. Here's what he said when asked about masks being political theater.
Before the CDC made the recommendation change, I didn't want to look like I was giving mixed signals. But being a fully vaccinated person, the chances of my getting infected in an indoor setting is extremely low.
Well, that's interesting. He now says that he's following the science, right? And he's not going to wear a mask. That makes sense, right? It sounds fairly familiar. Take a listen to this.
What studies do you have that people that have had the vaccine or have had the infection are spreading the infection? If we're not spreading the infection, isn't it just theater?
No, it's
not.
not.
The vaccine and you're wearing 2 masks. Isn't that theater?
No, that's not. Here we go again with the theater. Let's get down to the facts.
Senator, you feel a little vindicated?
Well, I'm just glad that Dr. Fauci has now chosen to accept vaccine science. Basic vaccine science says you can't get it after you've been vaccinated. That's why we get vaccinated. And yet he was unwilling to accept it. And he was performing theater, wearing masks, because he didn't want people to see him without a mask. It wasn't that the masks worked or that he needed it. You heard the way he phrased it. He didn't want someone to see him without the mask. So really it was theater. But here's the other question. You know, all these retailers are now saying no mask. I don't think the mask ever really did help, to tell you the truth. When you do studies of the cloth masks, 97% of virus-sized particles go right through the cloth mask. They really don't work. When you do controlled studies in hospitals, you find that most of the cloth and surgical masks don't work for influenza-sized particles. Interestingly, the one mask that does work is the N95 mask. It has to be worn properly. But if you ask any doctor in the country, would you go in a COVID patient's room who's sick and on a ventilator with a cut-up piece of your undershirt as your mask? They would say no, they won't do it. The hospital won't let you in a COVID patient's room without an N95 mask because it's the only one that works. So all the other masks were theater.
You know, recently, host of MSNBC's Morning Joe, Mika Brzezinski, said she's still going to wear a mask despite being fully vaccinated. Listen to this.
I am working with a team here, and there is one person on the team who is not vaccinated. I'm wearing a mask around that person. You know, it is really, if you want to follow the science, then there are times you need to still wear the mask.
You know, Senator, it seems like because Biden and Fauci took so long to trust the science that now people are not having so much confidence in the vaccine.
You know, well, Mika needs to go back to elementary science class. I doubt she ever really took any science, but if she had, the idea that she's been vaccinated and wearing a mask around someone who's unvaccinated, it really has nothing to do with the unvaccinated person. It has to do with the vaccinated person. She's vaccinated. She has a very, very high chance that, one, she won't get it at all, or if she gets it, she has at least some immunity to be able to fight it off. So she's sending the wrong signal to people. We still would like more people who are at risk to get vaccinated, but if we send them a signal that they're just making up this science and that they're treating us like imbeciles and they're doing things for show, it actually discourages some people who are hesitant to get vaccinated. I think high-risk people should. Voluntarily. I wouldn't tell anybody they had to, but over 85% of Americans have figured it out. They've been vaccinated. I think that number still could go higher. I would add to that people over 40 who are overweight. I would call a high-risk category. Over 40 and overweight, I would recommend they get vaccinated. But I wouldn't be out there telling 12-year-olds we're not going to let you go to summer camp or we're not going to let you go to school or get on a plane unless you're vaccinated. If you want to be vaccinated, fine for kids, but it really is not something that I think we need to mandate or say you can't go to school unless you have been vaccinated. So we need to really not treat this as a one-size-fits-all. This really should be individualized, and that's the way healthcare should be in a free society.
I agree. Yeah, it's ironic that these guys talk about trusting the science unless they don't want to trust the science themselves. Interestingly, Senator, last night when I got home in the mail, I had a letter waiting for me from Rand Paul. So excited to be able to talk to you. I thought maybe you wanted to get ahead of the interview. But in this letter, you talk about the Life at Conception Act. And ironically, just yesterday, the day I get this letter, the Supreme Court says it's going to consider the legality of a Mississippi abortion law that seeks to ban abortion after 15 weeks of pregnancy. President Biden says he wants to codify Roe v. Wade. You really make the case in this letter that this act needs to get passed to codify life, the definition of life. Where do you see this whole issue going right now?
You know, I think when the court looked at this in Roe v. Wade, they said that Congress had never really defined when life began, and so they got into a murky area. So I think Congress should define when life begins. We've had several bills that have come forward talking about when the baby feels pain. And I can tell you, a few years ago, I interviewed with a very prominent woman over at CNN who was 20 weeks pregnant at the time, and she was goading me about being against abortion. And I said, well, you realize at 20 weeks that the baby can feel pain, avoid needles, and the baby goes through excruciating pain if you try to destroy the baby. And interestingly, this anchor edited the show, took out that clip because I think she felt guilty seeing as she was that pregnant at the time. And so I think even people on the left, when they see pictures of 20-week-old babies and they see a baby trying to avoid, and realize that when you do surgery on a 20-week-old baby in the womb, like let's say you're going to fix their kidneys, they actually give anesthesia because the baby feels the pain of the surgery, this corrective surgery that's done in the womb, they actually give anesthesia. So I think these things all argue for there being a person there, a real baby, and I think it gets harder and harder for them to argue there's nothing there. So I think we're winning in a way, and ultimately we're going to save lives if we keep it up.
Thank you, Senator. Appreciate your time. Yeah, if they would just listen to the science on this matter. Appreciate your time tonight.
Thank you.